Okay, my name is Felicia Grant Hopkins, and I am your MC for today's program. I am a member of, an employee of the Harford County Health Department Minority Health Program. Has anyone here ever heard of the Minority Health Program from the Health Department? Yeah, thank you. Thank you back there. Thank you. Thank you. Thank you. Okay, there we go. I say, wait a minute. We've been out here since 2021, and we bring awareness to the high needs of health and health disparities here in Harford County. We've been doing this this will be our 5th year. And we bring awareness to like cancer prevention, but things about hypertension, things like diabetes that plague our community. And so I am glad to be here. I am super honored. Are you guys excited? Are you excited? Oh, God, excited! Listen, I want you to know something. Tonight, you are here making history with us. This is the Generational Health Symposium. Groundbreaking. It has never been done out here in Harford County, and especially where it is geared towards a multicultural audience. And so we are glad that you are here. We are glad that you are participating, and we are glad that you are starting this year out wanting to take care of your health. Am I right about it? That's why you woke up this morning. That's why you all registered. That's why you all are here, because we need to do something different about our health. And so what makes this event also different is the fact that if you all have read Dr. Roch's book, you would be able to see in there the groundbreaking information as far as health and wellness is concerned. And I am super excited for you all to find out more about that today. So Dr. Roch has put together this, Dr. Roch has put together this to help our children, our grandchildren for generations to come. And one thing that we've also done is the fact that this is a multi-generational conversation. If you look around us, there are many people of different age brackets here. And on the panel later on today, you're going to experience that as well. And so I'm super excited. Let me see what we're going to go through next. Now, on your cards, on your chair, does everyone have, just look and see that you have this on your yeah, okay? So I'm going to turn your attention to this. We're going to have a Q&A panel later, okay? And you want to write your health-related questions on that card for later. So take a minute. So you don't have to do that right now, but if you have some health-related questions that you would like to ask our expert panel, please write it on there. There's a pen there for you, and some of you have sent in your questions, but please write that on there. While you can do that right now, take some time to write on there your health questions that you might have for the panel later. And also, I wanted to share with you a little bit about myself, about the fact that I'm not only just an employee for the Harford County Health Department, but I do sit on the Health and Wellness Committee for the Harford County Caucus of African American Leaders. And the fact that Dr. Roch and Dr. Joyce have taken the time to put this together, it is groundbreaking. It's groundbreaking because of the fact that for years we've been talking about how we can bring better health to our generation, how we can take charge of our own health, how we can be able to have a simplified way that we can approach our health, whether it be in the healthcare system, whether it be going to the doctor's appointment, or whether it be in our own homes. How can we simply do that? Take charge and take responsibility. And so this right here in Harford County is really history making because of the fact that they have gathered all these experts to be able to minister and outreach to us on taking charge of our health. Are you excited? Yes. Yes. Are you ready to go on this journey with us?
Yes.
So I do have a question for you all. Okay? Are y'all ready? Yes. This is going to be kind of interactive, so I need you all to kind of spruce up and listen. So I need to ask you, what is one expectation that you have today? What is one expectation that you have today? This is interactive. I'm asking because guess what, y'all? There might be surprises for you, for those that stand up and let us know. What is one thing that you expect to take away today? What is it that you expect to learn today? Come on, y'all. Thank you.
I'm expecting to learn how I can manage my health in such a way that in the future I'll be just as healthy or healthier.
Yes, yes, that's really good. Yes, that is a good response. And guess what? Because she stood up and she was brave enough to get on the microphone, we have a prize for her. Anyone else? Anyone else? Come on. Oh, here we go. Here we go. The floodgates are opening up. Here it is. Stand up.
I came to get some information about health networking, how you can get in contact with others about different health issues. We are planning to do a fair, so I wanted to not only get health information, but how can we also get some of the partners that are here to come out and reach out where we are.
Wonderful, wonderful. So look, we got a prize for you. They're walking around with merch. Listen, that's a beautiful Dare to Live Well hat and a beautiful t-shirt. Do we have one more person that went? Oh, see, there you go. Before they were shy, it was just kind of reserved, but now, since we got some skin in the game, I got something I want to say. Go ahead.
Good morning. I think I would like to understand what we can do to prepare our youngest learners for school. So what can we do from birth to 5 to get our students mentally and physically ready for the classroom?
Wow, that's fantastic. That's fantastic. And I'm telling you, I was able to meet with some of the panelists this week, and I'm telling you, they are ready to answer these questions. This is fantastic. Before I go any further, the building that we're sitting in right now is something that might not be familiar to many of you, but we have a wonderful pastor here that is Dr. Marlon Tillman. He's in the back there, and United Methodist Church. I've known Dr. Tillman for many years, and one thing that I can say about him is that when he wants to get involved with an issue that is important to our community, he's like a dog with a bone. He's not going to let it go until he gets to the finish line and gets results. And so it is not surprising to me that he would invite the community and partner with the Herold on such an important topic as generational health. And by way of announcement, I always do this for him, even he's not paying me to do this, but he's also written a book about generational wealth. And he has taken that taken the helm on making sure that our families are well educated on how we can do this. We can do this. Can you say that with me? We can do this. Yes, we can. And so the other churches we have here with us is Pastor Herman Randall with Asbury UMC. Let's give him a hand. Pastor James Hamilton with Clark United Methodist Church. Let's give him a hand. All right. And Pastor Darius Butler of John Wesley of Abingdon United Methodist Church. Awesome. Listen, this is a movement, y'all. This is a movement. We're coming together, and we're coming together in the sanctuary where it really counts and where the message can get across to our parishioners on a much larger scale. So you all are making history. We are so happy to have you here. Thank you, pastors, for finding it not robbery to bring not only yourselves, but congregation members and parishioners here to join us on this fantastic journey. Let's give yourselves a hand. So, with that being said, I want to set some expectations for you today. The first thing, how many of you bought a cell phone? All of you? Yes, all of you, I know. Mine is not too far, I know exactly where it is, it's like a radar. I would like for each one of you to please put it on silent. You know, put it on silent so we don't interrupt any of the speakers, that you'll be able to hear and really take in the information that's going to be presented today. Amen? Amen. All right. The next thing I want to do is invite you to know that along with Dr. Roch and Dr. Joyce, I want you to know that they're a fantastic team. They have diligently worked in the community since for many years, but here in Harford County particularly, talking about health and wellness, and the fact that they brought all of these beautiful resources here today. On the side there, we have MS Integrated Healthcare, which is their personal business and brand, and it is amazing. I am a patient. And then we have the Harford County Health Department Minority Health Program. We have here, let's give them a hand, everybody give them a hand. Say it out.
Hi, I'm Gina with GSI Health
GSI Health and
and Wellness.
Wellness. Let's give them a hand. Not Bad Massage. Not Bad Massage. You want to just introduce yourself real quick too? Just hi. She's like, I'm on the spot. I'm so sorry, but Not Bad.
I'm the owner of Not Bad. Dr. Herold and Joyce are both clients of mine, and they are a huge inspiration of mine. I'm so proud of them. And I'm going to get emotional. I love them. They have backed my business, and that's been so important to me as a minority business owner. So I just want to say thank you to them.
Yes, and then we have Dr. Boyd, just briefly, because we're going to do on our panel, so just briefly.
Good morning, everyone. Dr. Boyd here. Thank you for inviting me out to this great event. I'm a clinical psychologist and a children's book author. So glad to be here today.
Wonderful.
And of course, we have Ames United Methodist Church Health and Wellness Ministry.
Wonderful. Wonderful.
Hi, I'm Dr. Marie, and I'm a pediatrician, but I'm also a lifestyle medicine doc, and I just really try to focus on multiple aspects of health to reduce disease, increase wellness and well-being. Cooking classes, walking groups, come over and see me.
Wonderful, wonderful. Let me tell you something. These are groups right here in Harford County, and they are accessible to you. So please, while we have a break, please go around to the tables and get information. They have great giveaways, and they have great, fantastic programs. Some of them are free, some of them have a cost, but guess what? When we invest in our health, that is priceless. We can't put a price tag on good health. And so please make sure that you visit them at your leisure. And so what we're going to also do is this, y'all. I need you to understand, I know it's early, but some of y'all been up maybe since 6 o'clock. We got seasoned saints in the room. And I know that they got up, they already cleaned the house, made dinner for tomorrow, prepped everything. Listen, and then we got some of our younger people that was like, Lord Jesus, what? What time did you want me to be here? 10? Oh my gosh, I got to turn over and hug these sheets. So we want you to do this. This is what we're going to do. When we call our panelists or anyone to the stage, we're going to practice this. We're going to stand up. Let's do it now. Let's stand up. We're going to clap our hands. Come on. Oh, come on now. Come on now. All right. And we're going to shout. We're going to say, woo! Woo! Yeah, come on. Okay, now try that one more time. Oh, that was Listen, it's going to be interactive. We're going to have a good time. Believe me. High energy. Come on, y'all. We're gonna stand. We're gonna clap our hands. Come on, guys. Thank you. Okay, now have a seat. Just stretch your legs out a little bit. And now what we're going to do, we're going to introduce, if you have never met Dr. Roch, you are in for a treat. He is the author of Dare to Be Well. He is an award-winning physician. He's the CEO and clinical director of MSI Integrative Healthcare. He's helped tens of thousands of people get out of pain with his cutting-edge Renewed Health program. He's a husband, a father, and a man of God. Stand to your feet.
What's up, everybody? Good morning, good morning, good morning. Look, I don't know if that was fake or not, but I felt it and I like it. You know what? Y'all are all right with me. Oh, my gosh. Thank you, thank you, thank you. Listen, there's so much to say. There's so much that I want to say, but I know that I want to get to our panel and just trying to get set up. I probably should have done that already. All right, so how y'all feeling this morning? Everybody feeling good? You look good. Can somebody tap your neighbor and tell them you look good this morning? Okay. Making sure, you know. All right. Now, I know this is a church, and I am a preacher, but I'm going to try not to preach, you know, even though it's in me, you know. So if y'all hear some preacheristic things coming at me, that's in me. Right? But, you know, now just giving honor to God, first and foremost, you know, without him, I wouldn't be here, we all wouldn't be here, right? So thank God for that. Thank God for the clergy that was mentioned earlier, Reverend Dr. Tillman. I know you're around here somewhere. Thank you so much for opening up your house. Listen, everybody, I want you to mark this date on your calendar because you all are a part of the start of a movement. How many people can say that I was there when this movement started, right? When the civil rights movement started, or when the women's suffrage movement started? You all are here for the movement. Oh, shoot, I got my neighbors here. Oh, shoot. Listen, we are all a part of a movement, and I'm so excited. It does not matter how old anybody is in here, you're all going to get something out of it, okay? So I'm excited for everyone, whether you're 1 or 100. Notice the book, Dare to Live Well. Lori is rocking the merch, the hat, and the sweater. Okay, Lori, I see you. Lori, okay. Well, Lori, okay, Lori. So Dare to Live Well. The subtitle of the book is The Ultimate Guide to Building Generational Health. There you go, right there. And I know somebody asked a question about, okay, well, you know, what do we got to do for the next generation? So that's what the book is all about. It was a burning desire of mine for a long time, and it was during COVID. It was actually during the whole COVID crisis. That's when I started to pen and write the book, and then from there, we ended up coming out with the book, and it's just been blowing up from there. Let's see what generations we have in the house so far. You know, so being that we're talking about generational health, did y'all know that a new generation actually just started this month? It's Generation Beta. Yep, Generation Beta. So that's the generation where they're basically going to grow up in a digital age, right? Can you imagine, like, what if school, work, everything was digital? What if you go to a museum with your grandchild or your child, and you see, like, a school bus is there, and they're like, hey, what's that big, you know, bumblebee-looking thing? Oh, that's a school bus. We used to get in those, and we used to ride to school, and we used to have to wait outside in the cold, right? So that's Generation Beta. Generation Alpha, okay, that's the ladies over there. Okay, Generation Alpha. Ladies say, woo! Okay, so, you know, we got Generation Alpha, we've got Generation Z, that's the first generation that started working, shopping, making friends online. That's 1997 and 2012. Now we got those millennials, you know. Some of y'all know y'all are not millennials, but anyway. So the millennials, 1981 to 1996, they became adults in the early 2000s. The millennials, you know, technology started to become a part of their everyday lives, and they want work to be meaningful. They value experience over things. You know? Okay, now, oh shoot, hold on. We're Generation X, baby! Okay, Generation X. So we're known to be independent, good with maintaining a good work-life balance, right? We were the first group to grow up with personal computers. Now the computers was probably this big, right? But we had computers. We at least were the first ones. I remember taking a typewriting class in my high school. Now my daughter takes a laptop to school. So you see how the world is changing? Yeah, technology is changing, and we're going to get into how that's changing now. Now, of course, I can't leave out, Lord help us, the loud and proud 1946 to 1964 baby boomers. I knew y'all were going to get rowdy. Baby boomers, they actually value relationships. They're very goal-centric, and they are resourceful. That's the Vietnam generation, right? So, as a baby boomer, and then if there's anybody here, God bless your soul, actually before 90, you know, you don't even have to say nothing. But this would be the silent generation, right? And those children, they were known to work very hard and keep quiet. That's why they were known as like the silent generation, right? They went through the war, they went through a lot. So we owe them a lot. We stand on their shoulders, right? We stand on their shoulders. So no matter what generation you belong, this event is for you. Like I said, I'm on a mission to impact at least 500 families. I think we got like close to 30 to 50 in here, so that's good. So we're on our mission. We're on track. And at least 50 organizations. And I want to just talk to them about what is generational health. So today, I want to just go over some major points in the book. I do want everybody, the book I believe is also available on Audible. The Audible book just came out. So, but I do want everybody to leave here with something, right? Joyce and I, we've been planning this. Everybody give it up for Dr. Joyce, my wife. That is, you are the wind when we are. I'm not going to start. Don't push me. All right. So what is generational health? How can we use it to make it better with our health decisions? That's one thing I want to talk about. What is the urgency of making your health a priority right now? Somebody say right now. Right now. Did I say tomorrow? No. Right now, right? Okay. And then what are some actionable steps we should be taking to live a better, healthier life in 2025? So the concept of generational health is basically, to start with that, why did I do generational health? I think the whole concept for the book I was actually adjusting. I was actually probably in my old office when the first concept started, and I realized just different patterns of patients as I was treating people throughout the years. I've been a chiropractor now, let's say about, I'll stop counting after 15, so somewhere between 16 and 17, but, I realized there were people that were coming, but they were bringing their kids with them. And I said, man, how influential is that? It would be like a 4 or 5-year-old looking at me, working on mom, working on dad. The first time I saw a chiropractor, guess how old I was? 24. It's after I said, you know what? I think I want to be a chiropractor, but don't you got to be rich to go to one of those people? Some of my patients are like, yes, no. But no, you don't. And I went to a family friend. He was a chiropractor, and then he introduced me to the art. But basically, that's where generational health comes from. The concept is really looking at your individual health as part of a larger formula and pattern. There are many factors in your health and in your lifestyle right now that is a result of generational patterns that have existed for years. There's generational patterns that have existed for years in your family and in your personal history. And the reason why we have so many of the preventable deaths and diseases that continue to plague our society is because we're not currently dealing with the generational health aspect of that. So there are positive and negative influences, and they're weaved into our life and patterns. So whether we like how dad, acted, or whether we like what mom did or not, some of that is weaved into us. And I want you to understand that you have the power to either shift or continue, whether it was positive or negative. The choice is yours. So many times, especially in healthcare today, people feel like like they don't have a choice, and they just have to accept what's been happening in their family. But I'll say, I'm in church, I'll say the devil is a liar, right? Because you do not have to accept what's been happening in your family. But so many times, I remember one time I was going over somebody's x-rays, and, you know, the guy is maybe about 35, maybe under 40, going over, you know, degenerative disc, all of this stuff, and I'm talking about all these good things and all these things that are happening now, and well, you know, if you do this, and there's spinal decompression, and actually, you know, there's all these new things that's coming out that can help you, but he just seems, you know, just real somber while I'm talking to him. I'm excited. I'm like this all the time, y'all, right? So I'm excited, saying, look, man, I'm so glad you found it. We've been helping people like you since for the past 10 years, and he was just sitting there, somber, and then I said, hey, well, what seems to be the problem? And the issue was that he's like, well, you know what? My father had surgery and my grandfather had surgery, so I'm probably gonna have surgery too. In his mind, he was already conditioned to just live his life how he wanted to live because there's nothing he could do about his situation. And that's not true. So that's why generational health is so important. You understand you have the power to control your own destiny. Lastly, generational health, it means that we're all connected in some way or another, right? We're all connected in some way or another. When you look at that there too, notice the two is actually a numeric. It's not written out as two. That was purposeful. Why? Because there's two people that I want you to always kind of hold on to and tap into whenever you are looking at, you know, your life and looking at changing it. One of them is going to be who is the person that positively impacted your life, right? Just like I said, there was a lot of negative influences, right, that I could continue to perpetuate and continue to do, but then there was some positive influences. My father was always dressed up, ready to go early, did his exercise in the morning, and I like following after that, you know. But, you know, my uncle, he had a drinking habit, so I want to follow after that. I don't have to. Will this family member or this friend or all of this happened in my family, and I didn't like, you know, the results of what happened in their life. You don't have to continue that. You have the choice. So I need you to just touch your neighbor again. You're going to bug your neighbor while I'm talking. Touch your neighbor, tell him you got the power. Okay? You got the power to change. So the other person in that too. So one is, I heard somebody say, so the other person in the two is, who are you living healthy for? Sometimes when there's somebody in the hospital and they're in a coma, and when you hear the stories of them coming out, they said, man, you know what? I was thinking about so-and-so. And you don't understand the power of your will, the power of the mind, and the power that God has already gifted inside of you to make things happen as though they're not. So there has to be somebody, whether it's your kids, whether it's your parents, could be your friends, it could be somebody. And you know what? Even if it is yourself, you have the right to live a better life. You have the right to live a better life, and you have the power to do it. But it starts here. It starts in the mind. So why does all of this stuff matter now? Why does, what's the urgency of the situation? Listen to some of, a couple of just health facts. So while the American healthcare system, we're touted A+ in terms of dealing with the brightest, we have the brightest doctors in our healthcare system. By all means, we've got, life-saving procedures. You can't beat this. We've got it here. Cutting-edge technologies, research and development. We've got it here. I actually used to work for Pfizer for a year before I decided to go back to school, nonstop R&D, and they put, millions and millions of dollars into that. However, the current healthcare system is failing us when it comes to dealing with chronic diseases. When it comes to dealing with chronic disease, when it comes to dealing with addressing preventable deaths, and lastly, when it comes to deal with correcting for racial disparities, right? Because when all of these things, when you put all of these in a gumbo and in a pot, and you mix it up, but all these ongoing problems, they only increase the cost of care for everybody. And so many times in society, and so many times you see this in healthcare too, you'll see that people will say, oh, well, we don't have to deal with drug abuse over here because that's their problem over there. It's the people on this side of the track. We don't have to deal with alcoholism because nobody's dealing with it here. We don't have to deal with hypertension because nobody in my family has it. But yet, when you see that there are disparities in society, and you see that there is a group, and there's many different groups that have disparities, whether it's women dealing with issues, whether it's African Americans, Hispanics, but whenever you see disparities at a large scale like that, everybody bears the burden. Everybody bears a burden. So that's one of the things that I wanted to just stress. The ongoing problems, they increase the cost of care, and right now, it's still going up. We actually grew the U.S. healthcare spending actually grew 7.5% in 2023. So that's reaching, I usually give you know what, I'll do one trivia. How much, if somebody knows it, that was in my previous, okay, I'll say it. You can't answer, you don't get half of that. How much do y'all think the U.S. is spending on healthcare? Somebody says 10,000 is like the price of right, okay? Somebody's up, okay? Come on, give me the wrong number. It's about $1 trillion, right? What'd you say? About $2 trillion, okay? Anybody lower than $2 trillion? Lower than $2 trillion?
Probably like 2 million.
2 million? We're spending $4.9 trillion on healthcare, and that was just in 1 year, and that equates to about $14,750 for everybody in here. Matter of fact, you all are leaving here with $14,750. I thought y'all was going to jump up like police. Yeah, exactly, right? So 14,000. But here's the thing: you said, "But are we willing?" What if I said, "Look, you have the power to determine your own health and make your own healthcare choices"? I'm actually every year I'm giving you $14,750. Don't you think we would make healthier choices for ourselves? Don't you think we would pick physicians that we value rather than the physicians that the insurance company says that we can only see? Don't you think that we would start making better decisions for our family compared to just doing the things that we're just kind of told to do and not question it? So that's where we are, and that's what's the urgency of the matter. The inactive lifestyle and the poor diet of this country is actually what fuels and perpetuates the profits of this broken healthcare system. I thank God for Dr. Marie. They've got a nice program. It's called Walk with the Doc. And it's an amazing program, but it just gets you into physical activity, gets you thinking, hey, once a month I'm meeting with this group and I'm going to walk here, and it actually might be a doctor. It might be a cardiologist, a chiropractor, this doctor, that doctor, but at least you're getting in the mindset of doing something that's causing physical activity. And we all have to understand that we're pumping more money into a system that doesn't work.
Right.
So we're paying the most out of any other industrialized nation, but we're getting some of the worst outcomes when it comes to quality of life expectancy at birth, and infant mortality. And when you look at the African American community in particular, it skyrockets even more. I think Robin is going to go over some slides just to show you what the local health department, what they did a needs assessment did, and she's going to go over that in detail. You're not going to like this one, but I'm just going to say it anyway. Health insurance companies are no different. Let me say this. So according to an analysis, there was two companies, AdMed and United Healthcare. They actually tied for the highest denial rate. They tied for the highest denial rate, with both companies denying about a third of in-network claims for plans sold in the marketplace, and that's just 2023. So there's a race to the bottom with some companies, where if I can just put somebody in a cubicle and just hit deny, and you know what? A lot of times when we're having all these arguments about, okay, it's your problem, it's our problem, they don't care where you live. They don't care what your socioeconomic status is. I've had the pleasure of working with basically two demographics in two offices. I love both of my offices. I love all of my patients. But I've seen these issues happen across both offices, across socioeconomic platforms. So you've got to understand that it's bigger than just looking at a small community, and the barriers of and injustices in healthcare. What we've got to do is we have to at least be aware of these situations, and we have to be aware of what's going on. So if we don't sound the alarm now, it's going to be another 5, 10, 15 years, and we're all going to be in the same spot. We're going to be looking at Generation Beta, and Generation Beta is going to be dealing with hypertension. Generation Beta is going to be dealing with diabetes and neuropathies and all of these things going on. What are we doing for them?
Right.
That's why it's important today. That's why I'm so excited to see almost every seat here filled. And give yourself just a hand clap, because you all are determined to do something about it. So 3 major headwinds, and I don't even have the time to go into this, but right now, there's 3 major headwinds that are showing that this is another reason why now is the time to deal with it. There is an economic crisis looming within the healthcare. Remember, everybody remembers, was that 2000? Yeah, that's when I first moved to Maryland. Oh, Lord, me and Joyce were trying to get a house in Maryland in 2008. I thought Maryland was a land of plenty until 2008. And all the banks were shutting down. We were like, what? You know, what in the world going on? But for those that remember, 2008 was crazy. And so that was the housing crisis, right? Remember there was a bubble, bad mortgages, popped. So same thing, some researchers are saying the same thing is happening in healthcare. Why? Right now there's about 158 million Americans, all right? That's nearly half of the 330 million of the population that is covered by a combination of some type of subsidized healthcare. So that's Medicare, Medicaid, or some subsidized enrollment of the Affordable Care Act, right? So experts predict that that's going to climb. That's why you're seeing these medical doctors' offices that you're going to, they're getting busier and busier, right? And because they're getting busier, and usually most people in those plans, they face a lengthy delay of seeing specialty care. And then because of that, that's where the cost starts to go up with everywhere else. Also, the Medicare Trust Fund, that's about to, it's known to become insolvent by 2028, right? And then also, number 2, there's increase in healthcare costs. I can see it just within my company as a business owner. It's been skyrocketing here. I don't even ask the question. I already know it's going to be more expensive. And not even all my employees are on the healthcare plan. And it's still probably the 3rd largest expense outside of payroll, rent, healthcare, right? So you'll see companies starting to either cut back healthcare costs or something like that, but basically it's just unsustainable if it keeps on going up. U.S. employees paid about a shocking 10% more in out-of-pocket healthcare expenses than the year before. And then lastly, the number of seniors choosing Medicare Advantage is steadily rising. So they created that program. They didn't think a lot of people were going to get on it, but after they created that program, they realized, oh man, we didn't think that so many people were going to be willing to relinquish their choice that they have with Medicare for just, the added benefits and reduce financial risk. So there's more limitations on the Medicare Advantage. However, it's almost like the devil's in the details. Because I've seen just in the past, I would say 4 or 5 years, there's a huge segment of my population in the Medicare population that has just dropped off. And every time, we'll call and we'll check in on them. Oh yeah, well I got a new plan now, and it doesn't cover maintenance, doesn't cover wellness, right? So we've got to watch out for all of this, and all of this stuff is happening while we're sleeping. So what are some action steps? What are some action steps that we could look into? For one, we've got to create, and these are things I talk about in the book. We've got to create a renewed. We've got to have a preventative mindset. In other words, if you're waiting for the problem to happen before it happens, we're already too late. We've got to start, one, performing a health assessment, seeing what's going on, seeing, where are some areas that I might be weak, okay, I'm dealing with some mental health issues, am I seeing a therapist? I'm dealing with some blood pressure issues, okay, am I in front of a doctor, am I eating healthy, am I being active, am I doing all the things that I need to do to make sure that I'm ahead of whatever problem that I have. Okay, there's back pain that I'm dealing with, there's scoliosis, there's degenerative disc, am I at least seeing a chiropractor? Am I doing some level of physical therapy? Am I doing some level of physical activity? The next thing that I want you to do is you've got to build a healthcare team. That's what this symposium is really about. Okay, you've got to build a healthcare team. Building a healthcare team, and not just building a healthcare team where all the doctors are thinking the same. One thing I stress is that sometimes it's good to have an integrated healthcare team. So that way, okay, you know what? I do have a primary care. I need a primary care physician. Okay, I've got the pediatrician for the children. Okay, I do have the mental health therapist. I deal with back pain often, so I do see the chiropractor regularly. and I build, you build a healthcare team based on what you and your family need. In the book, I even talk about it when, there's a chapter that talks about chiropractic, because I get everywhere I go, once they find out I'm a chiropractor, it's like a line form, and people just start asking me questions. So I just answered all the questions that people always ask me about chiropractors in the book. So there's a book that talks about everybody needs a chiropractor. Like I said, many people feel like, I need pain or this and that. Sometimes it works on a preventative level. There was a study out west, and there was a group that was about, I forget the sample size, but it was a good bit. It was probably about 2,000 workers out west in the state of Washington, and they were just analyzing all of the people that had the same low back pain code, okay? Analyzing everybody that had the same back pain code. And what happened was that there was 42.7% of them, of workers with back injuries, who first saw a surgeon, and they had surgery within the next, 2 to 3 years. So roughly about half, about 42% of them. The same one, same code, same injury, they saw a chiropractor, it was about 1.5% of them had surgery. So the industry knows this information. But when patients are telling me, oh, well, my doctor never recommended a chiropractor, they know this information. They understand, right, Dr. Tibb? Right? So here's the next thing. So you build a healthcare, start with the preventative healthcare mindset, build a good healthcare team, okay? Integrate that healthcare team so you have different disciplines working towards the same outcome. Budget for your health. You can't say, I can't afford to do something that's healthy for me, but we're buying Starbucks or Dunkin', right? I'm not pointing at that. I'm not pointing, right? But we can't, there has to be, we have to reprioritize what's important, okay? We have to reprioritize what's important. Okay, I heard you talking about coffee earlier. I said, ooh, that's good for my mental. That's good for my okay. And then lastly, you know what? And that's the last, I'll just close with this. You want to join the community of like-minded people, right? So talk to your neighbor one more time and say, look, you my community. You my community, okay? Whether you like your neighbor or not, whether they bumping your shoulder or not, right? But join the movement. Like, we have a Facebook page, and I think we're gonna get people to, join the Facebook page and join the Facebook group. We're gonna have an exciting dare challenge for everybody if you dare to take on the challenge. But listen, I'm excited for just what's gonna happen in your lives. I'm so happy that each and every one of you came out, and sky is the limit. Don't let no doctor tell you that you can't do anything. Okay? I've had so many people that were disappointed because they came from other places and they were just treated like nothing. And it's not fair. It's not fair. And if in healthcare, you got to understand, healthcare is one of the only industries where we just keep overpaying, underutilizing something, getting bad service, but we have to keep paying for it again. Fire that doctor, find somebody else. Okay? So with that said, I know that I'm going to bring Felicia back up.
Yes.
Felicia!
Oh my goodness. Was that not amazing? I'm telling you guys, this is a movement. I am so honored and excited about this. Is a movement, and I want to just ask everybody here, let me tell you something, we're going to give away a couple more prizes, but I want you to think about what was your biggest takeaway from what you just heard. I have a few, but I want you to really thoughtfully think about that. What was your biggest takeaway that you just heard from what Dr. Roch just said? Roch.
It's Roch in French.
I would say that to build the healthcare team.
Yeah. Building a healthcare team. Listen, these prizes that you're getting right now, let me precursor this by saying this because everyone's gonna jump up. These are from the Harford County Health Department Minority Health Program, and we are giving away. We have health resources in that bag. One of them, I think, is the 5-in-1 hand blender with some recipes We also have an air fryer with special recipes and a Fitbit watch with some information. I know, see, now. See, come on now, y'all. Come on now. All right, who else? Who else? Who else? Who else? No, Joyce, you do it. You pick them out. You pick them out.
I got this side, you take that side.
Okay.
Don't bring it back.
I'm taking away that we're spending too much money on healthcare when we don't necessarily need to.
Yes, that is a very good takeaway. And so right now, we got one more prize, but we're gonna wait till later to get that out. You wanna do it now? Okay. Who else?
Good afternoon.
Good afternoon. $4.1 trillion, $4.9 trillion spent in healthcare, and we're getting the worst care of any industrialized nation on earth. Wow. I'm going to share my takeaway. I had my father, he died of a heart attack in 2017. My grandmother died of a stroke in 2014. And in that same year, in 2014, I had a Nana, which is my mother's mother. And you know what? She died of old age. And you know why? I watched her over the years. She ate well, she walked, she exercised, and she was 94 when she died. My mother now, in 2008, she takes care of herself. She takes vitamins, and she walks. And so I said to myself, even as I'm looking at this audience here, multi-generational audience here, I want to be that generation that helps my children as well. How about you? How about you? You know, so it's what we see, and I got that takeaway when you mentioned that. And so we're going to move on next. I'm going to introduce one of my good community friends that really got me out here in the health field. She's really near and dear to my heart. She was able to, she's been out here by herself as a minority individual doing community health, but then as a certified health minister, Robin Stokes. She has paved the way for me, and I always say this, because, just like what I say with Dr. Tillman, because she walked alone, I can run, and we run together. And so I'm going to welcome to the stage a certified health minister, a community advocate, and let me tell you something, she is a powerhouse of information within herself. So please, Robin Stokes, come on up. Thank you, everybody.
Okay, as you've been sitting here listening, and I'm going to answer the question, why? Why all of this? Yeah, hello, you can hear me? Share this. Okay, y'all need help over here.
Millennials in the house.
Okay, so some of you remember, here in Harford County, we have community health needs assessment. This is done every 3 years, okay? And what they do is it's demanded, every jurisdiction in the state of Maryland does it. We just completed our 2024 here in Harford County. Okay, guys. All right, so this is the profile of Harford County. We have 264,644 residents. Thank you. Okay, and you're looking at, 25% of our population is under 17 years old. Most of us, medium income, whatever. I'm gonna keep moving on because I really want to get to the important part. So this is our location of where our residents and we live by, race. Keep moving. If you look at this slide, you'll see, again, as I said, 25% of our population, is under 17. So we really have to focus on that group. And also the older adult, as you see from, the ages 65, 55 and up. Here you'll see the top 3 causes of death here in Harford County. We fare worse than the state of Maryland when it comes to suicide rate, death rate for all causes, and heart disease. And we talk about the social determinants of health. It's the conditions on how we live, work, pray, and play. And some of these conditions are different from everybody here in Maryland. So this is the community health needs assessment. It was 50 questions, 2,242 respondents. That's the people that participated. Now remember, we have 264,000. That was less than 1% of this population in Harford County that participated. This is a health assessment that is done with the health department and the hospital. This is very important that you participate in this survey. Okay, and what I'm going to show you is the demographics of the responses of the people who did participate. So 73% were females, 14.25 were Black, African Americans. We make up 16% here in the county. Not bad, but we still got a long way to go. Okay, this shows you where the zip codes of those people who live. Most of them came out of Bel Air, followed by, both Bel Air. Both zip codes of Bel Air. Okay, from this survey, the top 3 concerns were overweight and obesity, drug misuse, and mental health and suicide. In Harford County, Blacks have the highest rates of depression, ED visits, highest rates of hospital visits for depression. Okay? African American women are overweight and obese. We have the highest rate of obesity here in the county. And our children, our obesity rate for our children from ages 2 to 19 has more than tripled, from 5.5 to 19.7%.
Wow. My Lord.
These are the top the survey response again. This were their conditions, their top health issues. As you see, overweight and obesity, misuse, and it's followed by mental health, cancer, and diabetes, heart disease. They do not work alone. The respondents' chronic conditions were hypertension. Hypertension is one of the #1 reasons with the most ED visits here in Harford County. High cholesterol, and as again, depression, mental health issues. The leading causes of emergency visit, as I said before, hypertension. We're still doing too much here in Harford County. Not better than the state of Maryland, but and this happening across the state of Maryland. Heart disease is the leading cause of death here in Harford County. There were 2,573 deaths recorded in 2022, followed by cancer, #2, and COVID. And COVID was in 2021 because of the pandemic, but generally, historically, it's been stroke that's been followed by the cancer. We are looking at the mortality rates for heart disease. That's death rate. greater than the state of Maryland. When it comes to lung cancer, this is lung cancer by death. Lung cancer is the number one. Lung cancer is a result of tobacco use, which is the leading cause of preventable death. Because we don't have to smoke. And lately, I've been hearing about black men have the highest rates of lung cancer. When we look at obesity, in 2022, the obesity risk for adults was 43.6%, which was an increase from 39.7%. As Dr. Roch says, we have got to move. Our bodies were not made to sit. Yes, we live in a sedentary lifestyle, but our bodies were not made to sit. And I'm going to ask you, think about the lifestyle, even for the young people. What is your life? What is the quality of life you want moving forward? Again, so here are the high school students that are overweight and obese. In 2014, they were more overweight than obese. In 2021, they have caught up with each other. 30% of our high school students are overweight or obese. Okay, and these are barriers to healthcare, as Dr. Roch said, cost out of pocket, trying to get appointment, things like that. When we look here in Harford County, primary care doctors, we have our tools. But here in Harford County, and it's not just Harford County, it's across the state of Maryland, for every one primary care doctor, there is 1,850 people. When it comes to dental, for every one dentist, there is 390 people here in Harford County to that one dentist. So these are also risky behaviors. We can no longer take these risks. Again, these are the resources that the respondents say they needed: affordable medication, elder services, mental health. Transportation is the issue, and access to fruits and vegetables. Again, so I'll keep moving along, but what I want to say, this survey is also on the website of Upper Chesapeake and the Health Department. The previous survey from 2021 and the one from 2024 will always be posted. So my takeaway again, when that China survey comes back in 3 years, we need you to participate. I can share this information with you in your organization, but also even in your churches. And I kind of brought it down so we don't have to wait for 3 years. Do a health assessment in your church. And I can call on me. I can help you do that and put that and implement the health and wellness ministry in your church if you do not have it. Thank you.
I'm sure if you weren't at a setting like this, you would not have known or heard this information. And it just begs to the issue that we need to make our health not only a priority, but dare to be well. And the book authored by Dr. Herold, A Movement. Do you agree? Yes. All right. Right now, we are going to stand up and we're going to take a little break. Don't leave. We're going to take a little dance break. This sounds like we're getting ready to slow dance, but while we set up for our panel, we're just gonna move our feet a little bit. We're gonna do a two-step. Y'all know the two-step? To the right. To the left. Take a little break. Stretch. Talk to your neighbor as we set up for our panel. The bathrooms are right outside. The panel will be ready in 1 minute. So y'all don't leave, but the panel will be ready in 1 minute. You want to just grab some refreshments in the back and just have your seat. Move those legs around a little bit. All right, we're getting ready to get started with our panel. If I can have everybody's attention real quick as we come back to our seats. Everyone, did everyone get one of these? Everyone get a note card? There's some up on the seat, so please come and get one. Everyone have one of these? Everyone have an agenda or a poster board or the agenda? Yeah, everyone come and take your seats. We're getting ready to get started. If everyone can come and take their seats. We're ready to get started. Thank you for those that are already seated. These are on a lot of the seats. If you don't have one, please come and get one. Dr. Joyce, do we have more of these or just the ones on the chair? Yes, if you don't have one, please get one. And those that are seated, can everyone hear me? We're going to take our seats right now. Bring a light. Come on now. You guys are doing so good. The light bulb. There you go. Thank you. Listen, I want to draw your attention on a lot of the seats. There's this program. Some of the seats in the back don't have this, but if you would like one, there's some on the front that you can grab. And I want you to look on the back and it says notes. And please take about 60 seconds to just write down, based on the things that you heard, based on the things that you're now in your mind is thinking about this movement and health and how we can do better. We have an expert panel that's about to come up. Write down your questions. And what is going to happen is that we have some questions that those of you that registered, we have them on the card here. But if you weren't able to write, or you might have just thought about it now, that you would like to write down a health question for the doctor, please do so now. Take some time and write it on the back of one of these forms. Oh.
All right, how do we welcome our guests?
Yes.
Everybody stand up.
Yes, and so I'm going to introduce our guests. Take time, and those that are still coming in to sit. We have here, and I love this, I love how Dr. Joyce did this, and not just had, just one generation of experts, but she got multi-generational. Think about that, that's the word of the hour, multi-generational conversations, multi-generational health, so I'm really happy about that. I first, of course, want to introduce our first panelist, which is the author of Dare to Live Well, Dr. Roch Herold. Come on, and clinical director of the MSI Integrative Healthcare in Bel Air, Maryland, also of the Ultimate Guide to Building Generational Health, right? Dare to Live Well, Ultimate Guide to Building Generational Health. And I want you to really high energy for this one, for his lovely, phenomenal wife. Dr. Joyce Herold, the healthcare executive of MSI Integrative Healthcare. And so she put this beautiful program together. They make an excellent powerhouse team, and we're glad to have her on the panel. Right? Okay. Next, we have nurse practitioner Ebony McCoy of the State of the Body LLC. We gave her a hand, and now we also have Dr. Melissa Boyd, clinical psychologist and children's book author. Next, we have Karanja Smith. He's a healthcare executive and a life coach. Robin Stokes, certified health minister and community advocate. And then the special guest we have here, what I love this, is we have Kiana Mack. She's an RN and former athlete. And Roch Herold. She's a Maryland middle school student and student athlete. So we welcome them all to the panel right now. And as I said before, there are some questions that were already submitted by a lot of you. I'm going to stand over here so you can see them. And I'm going to start with a general question that was submitted via the invite, okay? And so the first question, what is the best way to choose a primary care physician? And when you answer the question, if you're answering it for the first time, just reiterate your name and who you are and what you do, and then answer the question. So what is the best way to choose a primary care physician for our family?
Hello, my name is Kiana Mack. Again, I'm a registered nurse. I specialize particularly in pediatrics. I just wanted to give a quick thank you to Dr. Roch and Ms. Joyce for allowing me to speak here today. So obviously I'm a little on the younger side, so my parents have introduced me to all of my physicians. However, they have given me the autonomy to allow me to give input on what I like about them. And it's so funny because I was just telling the story to somebody else that when I was younger, we had this physician and she retired and she moved and we got a new physician. And I was probably like maybe 10 at the time. And I had to work up the courage to tell my mother that I did not like the way this doctor was speaking to me. And it was hard for me, I remember, because I have respect for authority. That's how my parents have taught me, and this is a doctor. You know, they're supposed to know everything. And so I had to work with the courage to tell my mother that I did not like my doctor, and she went shopping, I like to say shopping, for a new physician for me. And so what I would like to say to that is that don't be afraid to say that you don't like the person that's caring for you, because it's your health, it's your need. So shop around. If you need to, it might take a little bit extra work, but in the end it'll be worth it because it's your health.
Wonderful.
Robin Stokes, primary care physician, if they listen. You have to listen to your nurse. She said, you have to like them. And when you have a connection with them, you'll know that they go beyond and really think about what you're dealing with, because they're listening and they're taking it in and they're making decisions on your health. But again, you are your best advocate when it comes to health.
So just an additional point, I'm Ebony, the nurse practitioner. You want someone who's going to collaborate with you. So if you bring an idea to them and they have an idea and you guys can meet in the middle with it, then that's going to be a good provider for you as well. Also, if you see someone around you that takes care of themselves, is healthy, ask them who they go to, because more than likely they're going to have a good provider, and if you admire how they live. So remember, you talked about the two people with the Dare to Live Well, the two. Reach out to someone that you know and say, hey, you seem to be in good, that you take your health very seriously. Do you have who's your primary care provider? Do you think that I could meet with them as well?
How you doing? Karanja Smith. So all of those points are excellent points. You're really looking for a partner in your health journey. You want a partner. There's also surveys. You can look at your primary physicians and see what kind of surveys, how are they matching up against other providers in your area. You know, take a look at what their results are. There are surveys that are coming in, the comments on previous patients. You know, don't just take what they're saying for, you know, the gospel. You need a partner that's going to listen to you, that's going to respect what you're saying about yourself. There was something that I saw on LinkedIn, and I wanted to share with you guys. If your doctor prescribes you medication without first asking you your diet, your sleep, your exercise routine, your water consumption, whether you have any structural issues and the stress in your life, then they are a drug dealer.
Whoa! Heard it here first, folks. Heard it here first. And basically, the only thing, I mean, that's powerful, but, you know, if you look at, like, the root word of doctor, it basically should mean teacher. You should be learning something when you're going to a healthcare visit, something new about yourself. Right? So that's why they exist. I do want to say this, since we're talking about primary care, because when I was doing the research in the book, I actually, in chapter 2, I go over overcoming the obstacles, because so many times when people have that one bad negative experience, oh man, they didn't listen to me. Now it's been 10 years and you haven't been back to the doctor. You can't afford to wait. They can afford to be mean. You can't afford to wait. Okay, if that makes sense. So, and then another thing too is that understand that the advent and the explosion of all these urgent care centers, they're good and they're meeting a need to get all of these people out of the ER, but it's not the same as having a primary that's watching you and your family generationally over the years, and they're tracking your blood pressure. They know your habits. They know they're talking about good, healthy lifestyle and things of that nature. But you know, so many people, they're replacing a primary care with urgent care, and that's a very dangerous position for our society, because the bedrock of our healthcare system is a primary care physician. You know, and lastly, WebMD is not your primary care physician. Okay, I'm talking to the brother in the back. No, I'm just kidding. So WebMD cannot send you off for blood work. If something's going on with your child, you need a good pediatrician, right? You can't just look it up. Okay, this looks like a whatever rash or whatever, when it's something totally different. You might need to get sent out for blood work. You might need a routine, diagnosis test and things of that nature. So they're out there. Don't let, and that's when That's why I'm very adamant about doing things like this, so you can see what great healthcare professionals look like in the back, and you can ask them questions face to face. And that's why things like this need to be more reoccurring and common, but just keep that in mind.
And I'd like to add that, when you go to emergency room, that's for medical emergencies. They open up your chart and they close it. And as Dr. Roch said, when you have a primary care doctor, they have your medical history. That is your medical home. So yes, if there's an emergency, please go to the emergency. But yes, we need to have a medical home.
Couple things. Thank you for the question. That microphone we're gonna put another microphone over there. That microphone is for you. If you have a question and you wanna ask it publicly, you can just go right up there and we will take your question next, okay? So the question about primary care. And Dr. Roch talks about this in Dare to Live Well. Referrals. And Nurse Ebony mentioned this as well. Most of us, we go to the hair salon from a referral, we go to the massage, the spa, even our shoes. Where do you get those shoes? It's a referral. So primary care is no different. If you have someone that you admire how they take care of themselves, ask them who their primary care is. If that doctor is accepting new patients, then here's the part 2. Interview them. All right? Because it's a privilege for them to take care of you. I think that we have to start valuing ourselves the way the Lord sees us. And so it's a privilege for Roch to take care of his patients. He tells us all the time, he trains the team to say, listen, treat my patients how you want to be treated, because it's a miracle that they walked in here today. Come on, y'all. So interview your doctors, make sure y'all are on the same page, and then move forward. That's what I would say. Thank you.
And this is why they are taking the charge, because just as simple as listening, the mental state of mind that we have to do to change, and letting us know that you are worthy to advocate for yourself, to interview a primary care physician, and change if need be. So these are all excellent gold answers. So I'm going to go to the next question. Is there any way to control high cholesterol levels without taking medication?
We just saw the stats that Ms. Robin put up on the screen. So this is a loaded question, you guys, and I don't want to take up a lot of time, but I do want to kind of get to the root of it. When you have high cholesterol, could it be genetic? Yes, it could, okay? But there are foods and things that we can do to shut those genes off that don't contribute to the cholesterol continuing to go up, okay? So that's where the nutrition part comes in. But when you have high cholesterol, that means that your body is trying to heal inflammation. So we have to get to the root of why you are inflamed. Look at me, okay? When you look at me, you would not think that I had high cholesterol, but I have high cholesterol. We had to do a deeper dive into why my cholesterol was elevated. My mom is sitting right back there. Since a baby, I had it. So is genes playing a factor? Yes. Just recently got some blood work done, you guys. Genetically, I'm allergic to eggs. Genetically, I am allergic to gluten, which causes inflammation in my body. And when there's holes in my body, my cholesterol is saying, hey, we've got to fix this for her. That is why my cholesterol is elevated, you guys. Joyce knows we go walking. I eat all the things I'm supposed to, but if the food isn't just processed foods and different things like that, you may be having an allergic reaction to a food that you don't even know that is causing the cholesterol. So that's why you have to get the blood work. And this blood work is not covered by your insurance. It's not. But how many of you guys have an HSA card? How many of you guys, what's the other card? FSA. Y'all know what it is. You have those cards.
then we can heal you. And then you don't have to take atorvastatin, simvastatin. Do you want me to go on and on with all the stats? Do you understand what I'm saying? So this is why you need a primary care provider. One that thinks outside of the box and wants to get to the root of the issue so you can fulfill the purpose that God has for you. Okay?
Dr. Boyd, a clinical psychologist, and I just want to add to the response that what contributes to high blood pressure is also stress, whether that be anxiety, depression, but mental health very much can impact emotions, feelings, impacts our body as well. Stress has been found to be related to high blood pressure, high cholesterol, impacts our sleep, greatly related to heart disease as well. And so when we're paying attention to the genetic factors and lab results, it's also important to pay attention to the stresses that are going on in your life because it greatly impacts how your body is functioning. And Nurse Shara mentioned the inflammation in the body, and that's also greatly related to stress as well. So when we are stressed, it actually contributes to areas in our body being inflamed. And so outside of just inflammation, stress also, if someone is sick, it also contributes to the impact on healing as well. So it's important to pay attention to the mind and body factors.
Oh, can I say one more thing about stress? Can you guys stand up so we can see you?
Oh, Mama said that. So one thing, you know, a healthcare provider could ask you, are you stressed? I had one ask me and I just laughed. Like, what kind of question is that? Life is stressful, so your lives are stressful. But let me make stress more practical, and she may be able to as well. Anything that don't got nothing to do with you, you don't need to be stressing about.
Well, say that.
For the people in the back, for the people in the front too. Okay. If it doesn't have anything to do with you, you need to leave it alone. Because she just exposed how it's affecting your body. If you are in a stressful situation, like Dr. Roch mentioned, get in a walking group, get in some type of physical activity to help decrease the stress that you don't need to. Your life is stressful and you can't run away from your life. She said the suicide rates are up here in Harford County. You cannot run away from your life, but if it's not something that has anything to do with you, you don't need to manage that. Okay?
Absolutely. My goodness, these answers today. And again, oh my gosh, I'm learning so much. Again, if you want to ask a question, feel free to walk over to that microphone and ask the question. And Dr. Boyd gave us a good segue about anxiety. I have a question for our student and young adult panelists. How do you cope with stress and anxiety in your daily life?
Just in case you forgot, I'm Caleb Herold. What I do to cope with stress is sometimes I just go upstairs to my room, take a breath, and listen to some music. Also, I can go running. It's a good stress reliever. Getting into nature, it can be fun.
Listen, let me tell you something. You know, Caleb Herold is the son of Dr. Joyce and Roch Herold. And I'm looking here. They are teaching the principles that they are preaching. And so if they don't believe it, their children aren't going to believe it, and they're not going to do it. But his response was spot on. He goes upstairs to listen to music, and he goes out and takes a walk. He takes a mental health break. Excellent response. Do you want to answer that question as well?
My favorite thing to do is I like to work out. Working out is my hobby. I love to run. I'll run for miles and clear my head, and that's my favorite thing to do. Clearly I'm immobile right now, so my next favorite thing to do is journal. I have a journal. I'll write pages and pages and pages and pages of things that upset me. And I also have really good listening ears at home. My mom, my brother, and my dad, they listen to me. Sometimes when it's not too much. But I think it is important to also surround yourself with good people. Where my parents have taught me, there's sometimes just friends for everything, and you don't need to tell everybody everything. So if you have that one good person that you can trust, maybe sometimes you can just use them as a listening ear, and also just make sure they're able to receive what you're gonna talk to them about. Because you want to make sure that your people around you are also in good places as well. And another thing, along with journaling, if you don't feel like writing or typing or whatever, somebody told me that they like to do videos or voice audios on their phone and just talk it out, get it all out, and then you can keep it or delete it, however you feel fit to deal with that. But those are some of the ways I like to deal with my anxiety and stress.
This is our younger generation answering these questions, and we have young people. Oh, yes, yes.
I'm not a young person anymore. But I am, mother. And so but I am a youth director at my church, City of God. Shout out to City of God. And this may not be something that my son is able to articulate, even my daughter articulate right now, but they're surrounded by people who love them, and they know it. You know, Caleb and Krista, their youth director from Emerging Youth, Elder Angel Ayala, he's here. Caleb's English teacher, Mrs. Smith, is here.
She's my favorite.
You know, his one of his mentors that was his babysitter when he was a little one, Miss Kiana, is here, and their parents are here. Right. So their community is here. It's not just mommy and daddy. And so one misconception about youth development is that kids, you know, they don't have stress and that everything is fine with them and they'll be okay. They have real stress, they feel anxiety, they don't know how to articulate it, and we have to help give them the tools to navigate so that they can be empowered and that they don't lose hope. Amen? And so I wanted to just point that out because we are a village. We have created a beautiful community that's cultivating health and wellness, and so that is not to be missed. So I just wanted to share that and give a shout out to Caleb and Kiana for leading the
Powerful. We have a question. Oh, okay.
One more thing I would like to add to that, along to what Ms. Joyce was saying. Something I'm learning, like in adulthood, is that sometimes you have to meet people where they're at. I work in a pediatric ICU, so I see all sorts of kids from newborn to age 20 to 21. And they come in for a variety of reasons, but more recently, ever since school started back up, I have seen a lot of attempted suicides, and a lot of those kids are in middle school. So, you know, sometimes children have big emotions, and to adults, it might be like, oh my gosh, like, because I know sometimes I'm like, I'm tripping, but sometimes not all kids are intellectually developed to understand those emotions. Sometimes things happen and they're scared and they might be into things that they're not supposed to be, but you have to create a safe space for them to come to you to learn about those things. You have to create a safe space to talk about things that are bothering them, whether big or small. And I just think that's so important because when kids don't have that support in the community or they don't know that they're loved, they don't see that love, you know, it's hard to be like, well, who's really here for me? And kids feel that even at a young age. So.
Excellent. Sorry, just quickly, I just wanted to add, just to piggyback on the last two comments about creating a supportive environment. Also, Dr. Joyce mentioned teaching tools. It's also important as adults that we're modeling healthy coping skills. Sometimes it can be assumed that a child should just know how to manage a friendship issue, or they should just know how to manage, you know, stressor at school. But often they don't, or what they are seeing from adults are not healthy coping skills. Whether it's that we are yelling or becoming, you know, upset to the point where we're not expressing ourselves in healthy or helpful ways. And so we are our children or the children around us, we are their first teachers. And that's not just in regards to academics, also in regards to their emotional health as well. And
we're gonna go to the microphone over there. Yes, please.
My question is, turn it on. Thanks, sorry. My question is for Ms. Robin. When you were speaking, you were saying that the health survey was only responded to by a very small percentage of Harford County residents. I've lived in Harford County for 20 years. I've never heard of the survey. So my question to you is, what is being done to promote or market, the survey to, Harford County residents?
Okay, we, have put this survey out, and I personally have put this out in the churches. We've done, some of our community organizations, we've done focus groups. And again, my purpose here is to continue to put this out here so that each day, or every time I mention it, somebody like yourself, finds out about it. If you would like to, I have a, email blast, Water Wednesday. I started it since 2017. And it was because I saw the diabetes in the community then, and I thought at first it was because of the sugar sweetened beverages, but it's also about the obesity. Well, in that email blast, I have been able to send out information weekly, and I would love for you to get on my email blast, and so that you can continue to get the water recipes and the resources in the community. Also, I just want to mention the word of mouth. Just like Dr. Roch said, this is generational health. We've come up, I know I have, in a culture that sometimes like don't tell people your business. And that has hurt us. And so I challenge you to talk to your children about your health issues and raise them to give them resources and how to eat and move and how to take care of themselves at a young age. Because there are children out there now starting to have hypertension at age 20. So, and what we feed them is just like the doctor said. So I challenge all of you, if you want to be on my Water Wednesday email blast, also, again, in your churches, raise these issues in your church. The black church was our place for everything we needed to know. Keep it there. Keep telling it. Keep telling the story. And I also started a program in my church called Storytelling and Health, because too many of us feel like we're alone, and we're not. So please reach out to me. I will take your email information and add you to that. And again, as I said before, I can help you in your faith community to help implement some of these health and wellness ideas. And we have a lot of resources here also. When we talk about these things, there are programs. I work with Upper Chesapeake. I'm speaking from Ames, but not on behalf of Upper Chesapeake. But I will let you know there are free classes and resources that are there. Now, we do hypertension, we do blood pressure throughout all of the community. And on that form, it says, if your blood pressure is elevated, can I reach out to you? And many check off no. And every time you do, you don't get those resources. Because you just told them they cannot call you even if it's high. So be careful what you ask for. I mean, let's open up the door to our health. Again, I will say this, you are your best advocate.
Robin, is the survey posted somewhere publicly, and when is it posted?
It is posted right now on Upper Chesapeake website and the Harford County Health Department. Matter of fact, it is law that they have to post the previous one and the current one. So you will see the one from 2021 and the one from 2024 in both those locations.
That's excellent, thank you. And I wanted to say to Robin's point, I know that sometimes when people hear about the Harford County Health Department or any health department, they just associate it with maybe STIs or getting a birth and death certificate. But I want you to know, with the partnership that we've done with Upper Chesapeake Health and the Minority Health Program, we have changed that narrative. And so it is a place that you can go to get a wealth of information. Please look us up on the webpage. You'll be very surprised what you will find on the Harford County Health Department page and Upper Chesapeake Health page as far as free classes and resources.
Yeah, one other point before you said it. Dr. Marie back there, the Walking with the Doc. We have it in 2 locations. We have it in Bel Air, and we have it in Magnolia Elementary. And the reason we had it there because most of our black population was there, but we're not showing up. So we're not showing up. And guess what? Walking is free.
It's free. Thank you. Exactly. We're gonna go to the next question.
Good morning. Thank y'all for being here, and thank you for all the resources that are here today. And to that point, is kind of where I'm coming from, is the hidden population of minorities, black people in Harford County. They're not hidden, they're in the wide open, and we're not taking advantage of the resources rather than the kids in school or the parents. But I think about the question that was asked, about power, and you are your own best advocate because you're responsible for yourself. But what do you do to change that mindset? So my question is about mindset for the panelists up here, because the health begins with the mindset. Yeah. And, for many of our youth, this is their answer. They don't want to come and engage and be engaged because I can just go here. So what can we do to help change the mindset of walking away from technology and also seeking help on our, or change that mindset about being responsible for our own health? Because the first thing we'll do is say, well, I didn't hear that. Nobody told me that. And, as a former educator, I know that's not true because I know there's teachers every single day doing the right thing, saying the right things, and parents say, well, I looked through the book bag, it's in there, or you can go find it. So if you can just speak to how people can change their mindset here or help others change mindset, I would like to hear your views on that. I'll be in the back.
Thank you. It really starts with, I can tell you for me, one of the biggest influences in my life was my parents, because they raised me to be a valuable human being, period. Not black, not white, not Asian, not Hispanic. They raised me to be a valuable human being. And when you can come from a place of just being a valuable human being, then your perception of other people's behaviors, your perception of life, your perception of your opportunities in this world change. Does that mean that you don't face discrimination, that you don't face, favoritism and stuff? You do face it, but you perceive it and you digest it differently. And your persistence and your consistency on your journey is increased because of how you look at yourself. Now, when it comes to cell phones and technology, I dedicate my time to my kids. Meaning this, that when my kids are with me, we are active. Does that not mean that they spend time on the phone? They spend time on the phone when I'm taking my shower, when I'm cooking breakfast, when I'm cooking dinner. But when I finish, we're watching a movie. We're headed out to the store. We're going on a day trip. We're still going to the playground. And they're 12 and 15 years old. But my 12-year-old still asks me for a piggyback ride to her bed. Because I'm active with them. The way that we can begin to change the mindset of our kids is with ourselves. If I'm on my phone all the time scrolling, then of course they're going to be on their phone all the time scrolling, because they're like, okay, well, that's what dad's doing. So he's not talking to me. He's not engaged in my day. He's not engaged in my interests. But I'm kind of engaged in what he's doing. Let me do the same thing. I got one of those. Let me start. And then what happens is a habitual behavior that continues for days and weeks and years. And then you're untapped, like you're disengaged from your child's behavior, from their likes, from their dislikes, and you no longer have a pulse on what they want out of life. Because their pulse has shifted to whatever society is now saying. And so I encourage everybody to be engaged, be linked with your kids, spend time with them, have conversations, cook breakfast, sit around the table, watch a movie, go out to the playground. give a piggyback ride if you can. But at the same time, let's make sure we do that.
I wanted to give Caleb a chance to answer this because he recently, it seemed like it came out of the blue, but somehow I know it didn't. He decided that he wanted to become a runner, and he's been running consistently probably about 4 or 5 or 6 times a week for the last 90 days. So Caleb, I wanted to ask you, what changed your mindset? Like what made you want to change something in your lifestyle?
What changed something in my lifestyle was probably my dad. He's always trying to work out and get better, and I just wanted to be more like him.
We have to really re-engage our village, our families. That is another gold response. He's really taken this panel by storm with his answers. It's wonderful. Listen, and I don't want any parent that's here to feel like you don't have time to change the narrative in your own family. Yeah. You know what your family unit looks like, and God knows. And so start where you are. I know, and I'm watching the faces of some of the young people in here, and they are fully engaged. They're not on their phones, and they're not in their heads. They're taking the information in. So, Caleb, you're being a trendsetter right now. Get ready. Get ready. We're going to go to the next question. Good afternoon, everyone, and thank you for allowing me to share and to be present. In addition to reaching out to our community members who are living in the church, are we also expansive beyond the church in terms of other houses of worship, our Muslim community, our Baha'i community, our Hindu community, who have Black folks in them? So just wanted us to not to be just narrow, because a lot of people are not as active in the Black church as they were years ago or decades ago. A lot of Black folks have left the church for whatever reason. So you have folks who are participating in African religious systems, who may be around, who may also need this information, and that's all I wanted to ask. Thank you so much.
My information goes out to the community, but, like Felicia and we sit on other communities here in the in Harford County and spread this information. No, not just the church, but I started with the churches because most of us was where I was doing it individual in a county by myself. So I was looking at numbers, and it's been good for me to reach you by numbers. Also Felicia, she can speak for herself. A lot of the projects that she put into the community, with the Harford County African American leaders, we have several organizations that we have come together so that we can reach each other. So if you have an organization in mind that we have not encountered, please. But Felicia can talk about her projects within the community. We go to neighborhood associations, Harvey Grace Housing Authority. We're all over the county. But again, it's trying to get to the people and meeting people where they are. Thank you.
So, I don't want to take up too much time because I'm really not on the panel, but to your point, as far as reaching different cultures, we have done that. We've reached out to those because we understand that the Hispanic community needs to be reached. The Harford County Health Department does have a Hispanic community that speaks different languages, the Latino and Filipino community. We have also reached out to influencers, I call them, inside the African community as well. And it is up to them, after we present information, for them to take hold and be able to develop how outreach looks for them. We know what it looks for us, but we allow those individuals from different ethnicities to be able to tell us how outreach looks for them. So we do have that. And also we have programs on the table from the Harford County Health Department. Will tell you where we're at, because we also understand the uniqueness of the fact that there are people that are underserved in our community, And then there's those that are affluent that have health insurance and access to resources. And so we have programs like Parent Talks that are developing all up and down the Route 40 corridor, but we go all over Harford County. So we are not closed to any other culture or ethnicity reaching out to us. We will, like customize it for every culture.
That's absolutely right. And thank you for that question, Carla, because, you know, when we're talking and we frame it in a certain way, it might seem like we're leaving other people out. But the nice thing about healthcare is that it's a universal language, and so you'll see the panel up here, and our community partners are here as well. Our work is secular work. Our work is for the public, and so everybody is included. Everybody has a need, and we are meeting the needs in our lane, so to speak, for the community. And so, you know, Dare to Live Well is an international movement, right? Yes. And so we travel all around the world, mostly in the States, sharing the tenets of Daring to Live Well. And so we do this all over the place, you know. It just so happens that we are people of faith, and within our network, we do know a lot of people of faith, and so they ask us first. However, with that being said, please book some of these people here. Have them come to your respective groups, because we need to get plugged in, because it only takes one match to light a fire, y'all. You know, so let's light these fires so that we can begin to change our community, because one thing about us is that we're not going to leave you hopeless. There's always hope. As long as you have blood pumping through your heart, there is hope for you to change exactly what you want to change. Amen?
Amen. And real interesting, about 2 months ago, maybe 2.5 months ago, I saw a post, somebody said they were holding a meeting. I went to that meeting. It was community people. It was people who have been in gangs. Because you know what? They were tired of being tired. And they were actually saying, hey, I'm tired of being tired. I need to stop this. What can I do? This was community. Okay, these are grassroots people. So yeah, it's out there, and we're meeting them. And I think a coach has showed up, a human resource person has showed up. So it came across on the media. But we're living it, and it's just happening, and it can pick up anywhere. You can organize anywhere.
Thank you so much. And in the interest of time, even for all of our panelists, you guys are rock stars in answering these questions spot on. We want to give respect to the fact that we have others that we want to make sure that we get to. We have a super, super special announcement at the end that we want to be able to include. So please come up with your questions. So keep that in mind, y'all. Okay.
Sure. Hi, everybody. Thank you for having me and for Dr. Roch for giving this opportunity. I know how important it is. I played soccer with him before, so I know he lives what he's preaching. I am a former nurse, and one of the things that I used to encounter is you send people to the hospital, or you go to the hospital, and instead of having their needs addressed, they are sent right back, or they are just pushed away. And it seems to happen to certain demographics, and it wouldn't happen to other people, but it would happen to those people. Now, I actually had a chance where my wife almost lost her life at the hospital, because you go there and somebody started an idea and walked away. And it took being there to be able to advocate for her and be able to come back and say, hey, wait a minute, something is wrong here. And then we was able to work our way from there. So what I'm trying to say is, what are the advocates? These people have gone to the hospital, they have done everything that we have asked of them. So how do we advocate for these communities that somehow seems to be left on the side? I've had a lot of older people say this. Every time they go to that hospital, they die. They don't come back. And it is true, because they are telling the truth. It's things that have happened to people over and over. So it's not that they didn't go to the hospital. It's not that they didn't stand up. It's not that they didn't take their medication. It's not that they didn't do all those things. But somewhere we have a gap advocating for the people who are going through this versus the care that they actually get. And I was just wondering if y'all have seen something that maybe we might be able to jump in there and, hey, when you go to the hospital, this is what you need to do, or this is how you need to step up. I'll be in the back.
So, thank you. Hey, I'll see if we're talking next up. So, you know what Brother Raphael is talking about is actually a systemic problem. This is why I had to address it in chapter 2 of the book. And when you look at there's something called implicit bias, which means because of what you look like or because you're a woman, whatever you say, you're just complaining. Because in my mind, if I think women just complain and I have a patient that's just complaining, I do not think that, by the way. But you get what I'm saying? Like, there's already a preconceived notion in my mind of what this person, no matter what they look like, whether they're Caucasian, African American, Hispanic, if I already have something that I'm thinking about, and that person comes in, and I'm seeing nothing but that population. I don't live in that community. I don't know them, and sooner or later it just becomes like white noise. And it's like, this is the 6th time your neck's hurting. Okay, all right, just take this, and who's next, right? So this is a multifaceted problem because it's touching on just the nature of healthcare, where everybody's getting kind of rushed in and rushed out. That's part of it, and then it also goes into the disparities that exist and implicit bias that exist within the system. And this is why, when people say, hey, look, we live in a colorblind society, that's very hard that's almost impossible. Like, I want you to embrace whatever color I am, whatever culture. I don't care if you're Italian, Irish, Haitian, Jamaican, be proud of who you are and embrace it. But with that culture comes certain, certain characteristics and things of that nature. So the next thing that I would want to say, so just know that that's a systemic problem, and that's not going to change overnight. But that's another reason why I said in one of those action steps, I had to mention to you all, and I think it's chapter 7, chapter 8, but building a healthcare team, you have to know who's a doctor there that I can rely on. So even if I go to that ER, if you go to Franklin Square, I need you to mention, hey, Dr. David Pierre, okay? And how would you know Dr. David Pierre? Because you see Dr. Herold, and Dr. Herold said, hey, by the way, I want you to, if you ever go to Franklin Square, see Dr. David Pierre. He's a primary care physician. He's excellent. And if you at least know somebody there, then those doctors know, man, I can't mess up with this one. Right? Right? And it's a shame that it has to be like that in 2024, but, somebody said in the previous 2025. Oh, thank you. It's 2025. Thank you, Generation Alpha. But listen, y'all, Calvary is not coming to save us. We have to save ourselves. Somebody said that in one of my podcasts, and that's the thing that is very important for all of us to know. Like, we have to have that sense of community, and it has to be not just on the business side or whatever, but it has to be in healthcare as well. And as much as I try to, I don't even want to say skirt around, but sometimes, because, healthcare is universal, as Joyce is saying. Everybody needs healthcare. It's not just African Americans, Hispanics, everybody needs healthcare. But when you're talking about healthcare, and particularly in this community, as much as I don't bring it up, it's always an issue whenever I'm in these settings. So I can't then say it doesn't exist and everybody's colorblind, right? Like, I have to, as a doctor, I have to listen and say, man, you know what, if this is happening to him, and it's not the first time that I heard it, then this is something that's ongoing. So that's where we are. And that's why we have to, I'm the judge finish.
So, thank you for that question, and I'm going to try to be really quick, but I could very easily be turned up right now, because this is like my heart's passion. Today is the 21st anniversary of my mother's death. She died at the age of 44 for a treatable illness. And so that's my why. When you see the crazy eye come, that's my why. That's what keeps me going in terms of being an advocate for my health and my family's health. You could quite possibly be the change agent, the dare champion for your family. When I go to the doctor, I demand the care that I deserve, okay? Because of my family history, normal, average, breast cancer, what is it? Yeah, screening, okay, you monitor normally about 12%. Mine, because of my family history, is 44%. So I'm super high risk for breast cancer. When I go for my mammograms and my MRIs, I want to sit down with my radiologist and go over my images. But that is not the standard of care, folks. So when I go in, I let them know before I sit down, I would like to go over with the doctor my images. Let me go find out, but if the doctor has time, they have time. I'm paying to be here. I had to take off work, so I'm not getting paid. You're getting paid for me to be here. You have the time. And I don't care if they're uncomfortable doing something that is out of the ordinary for someone. Because I'm high risk and I'm a Black woman. So we're higher risk than everybody else. So you're not going to treat me the same way you treat everybody else. And that's the kind of care that we have to demand. You have to demand it. And it starts by knowing that you're valuable. I'm valuable. My son is about to be 13. My daughter is 8. I don't want to die at 44. I'm 42. I want to stick around for them. And sir, ma'am, if you can be my healthcare person, if it's a privilege for you to take care of me, you'll take the time to make sure that I understand how to take care of myself. So that is the answer. Take somebody with you to those appointments if you don't feel like you're empowered to do so. Know your worth, ask the questions, tap into your resources and say, okay, how can, I'll call Ebony and I'll ask her, hey sis, how should I approach this going into this appointment? Just like I would get advice on any other thing. So go equipped, ready to fight. Yes, it's hard, sometimes it's hard. Is it tiring? Yes, sometimes it's very frustrating. Because I left that appointment hot. Told my husband, I'm like, you wouldn't believe they do this. But that's what they do. And let me tell you something else. When it comes to health disparities, it doesn't matter what your socioeconomic status is. Black women across the board have the same disparities no matter where they live, how old they are, how much money they make, because we're treated all the same. And so all the same, we have to advocate for ourselves. Hardly, fiercely, and intentionally. Amen?
Amen. Just so you know, on the back table, there's an Ask Me 3 form. On the back, it has 3 questions. What's my main problem? What do I need to do? And why is it important for me to do this? And you can write this information down. So they're on the back table. There's some resources on the table. So if you need to lay out your appointment before you get there, here you go.
Okay, Sydney's going to ask the last question, then we're going to phase into the closing. Oh, sorry, Marcia.
So I'm actually just speaking on what Joyce just said. As a 24-year-old white female, I obviously have a different perspective on this. But my mother went to the hospital a couple months ago. She has been a recovering drug addict for 15 years. She has not taken one drug for over 15 years. And yet the second the doctor found out, they stopped treating her. She came in for nerve pain. She literally couldn't even walk. I had to reel her in. And when they found out, they stopped treating her as somebody that could have had a problem. And she called me. She said, I don't really know what to say. And because I work with Dr. Herold, who, by the way, is one of my favorite people on the planet.
I'm not paying these people.
He is not paying me. I just have learned an insane amount from him about everything in life. So I owe a lot to him. My mom called me. She asked me to come to the hospital. I walked in. I demanded to see her blood work. It didn't look right. And so I asked, can I have a second opinion? I need someone to come in here, explain to me what these bloods mean, because she's not in her right mind. They pumped her full of morphine, she is in pain. I'm like, you need to talk to me. We got a second opinion, she got diagnosed with chronic kidney disease. Wow. And they were just gonna dismiss her. Wow. So for us young folks that are here, you need to advocate for yourself and for your parents. Yeah. Okay, if she didn't call me, they would have just sent her home. Right. Who knows how long it would have taken. She's to the point where she almost needs dialysis. But if I didn't go in there, maybe she still is. Wow. Okay, so for us young people, Caleb, you included, just advocate for yourself and know you can ask for a second opinion. You can say no. Demand them to explain things to you. Ask them questions. They are there. They may seem busy, but who cares?
You pay their salary.
Exactly. So, that is all.
Awesome.
I'm so sorry. I know that we could be here for another 30 minutes to an hour, because this is really ramping up really good. We're going to allow you to make a comment, and Dr. Roch, we're going to ask you to close it out for the panel as well. To give last remarks for the panel.
Okay. Just real quick, just to address the last question. I've been in healthcare for over 20 years, and I've worked in 5 different departments. And what Dr. Roch is talking about as far as the systemic problem, this is a systemic problem across every race, across genders, across everything. There are VIP patients that come through to my email to say these are the patients we need to ensure that they are receiving excellent care. This is not just happening in one particular healthcare institution, it's happening in all of them. I'll give you a good example. My mom went in for knee replacement, I think this was in 2018, 2019. I used to work at this facility, and I happened to run into the CEO, Lyle Sheldon. Gave him a hug, talked to him for a little bit, and he asked me what I was doing there. And I said, well, Mom's getting knee replacement. He said, what time? I told him what time. When she came out of surgery, on her stretcher was a balloon with his business card. Now, what kind of care do you think she was going to get after all the clinicians saw that? The best care possible, right? So the advocacy is very important. You gotta be there for your family. You gotta use those resources, but also with what we're here for is to educate preventive health, educate you on how to take care of your body. Raise your hand if you would be willing to die for one of your loved ones. Raise your hand. I dare every hand that's raised in this room. I dare you to live for them. I dare you to live for them. That consistency of walking, that consistency of drinking water, that consistency of a proper diet is being replaced with a medication that you're taking daily. So don't say that I can't do that consistently, because you're taking that pill consistently. I need you to replace the pill with the good habits. I need you to replace the pill with proper hydration. I need you to replace the pill with exercise. I need you to replace the pill with contacting that loved one that you haven't talked to in a long time and repairing that. That will take you out of being in a psych ward. Okay? So let's make sure we're taking care of ourselves. I dare everyone in here to live for your loved one.
I know, listen, we're talking about our health. So I know that you might have some other things to do today, but please just indulge us a few more minutes so we can get these responses. And thank you. Go ahead, Kiana.
Really quickly, I think a lot of great points have been made, and I don't have to say that much, but one thing I do want to emphasize is to don't be afraid to make noise, to go higher than who is providing care for you. If you have a problem with that person and they're risking your life, risking your health, don't be afraid to go to management, talk to somebody to just make a change. Because if you're receiving that care, imagine who else is receiving that care from that same person. And don't be afraid to just change. You know, you don't have to stay with that. You don't have to receive that. You are in control of your health, and so people might make it seem like, oh, this might be too much. No, it's not too much. Just like Ms. Joyce said, it's never too much for your life, for your health, for your well-being. So I just wanted to add that. Don't be afraid to make noise.
Wow. We're gonna take our closing remarks from Dr. Herold.
Listen, for one, give this panel an outstanding. Oh my gosh. Whatever I was dreaming about how this was gonna turn out, it turned out even better. And also, you all showed up. And that's it. It's about the community. It's about you all taking charge. So, for one, I mean, thank you from the bottom of my heart. And I speak for everybody here. You know, yes, we can be the best providers and, you know, administrators and nurses, but if you're not showing up, then what are we doing? What are we really doing, right? You have to show up. When Brother Mac asked about mindset and all of that, it starts with you. It starts with you knowing that you deserve better. Knowing that you deserve better, knowing that you're not just an accepted. Why does something keep happening? Because we accept it. And sometimes we need stuff like this to say, you know what, I deserve better, I'm gonna demand better. And and you know why? Because you're already paying for better. Right? $14,700. Okay? So you're already paying for it, so why not? Why would you go into Starbucks, you're gonna pay $10 for the coffee and they're gonna give you like 3 drips and you're just gonna walk out and say, okay, thank you. Right? I'm going to Dunkin'. Right? So but listen, thank you all so much. Reverend Dr. Tillman, where are you? Did you have any words? Guys, give it up for the chef.
Dr. Roch, I am so sorry. I'm so sorry about that. Dr. Tillman, before you speak, I want to make sure, before we let you have these closing words, how many of you have the book, Dare to Live Well? The presentation that Dr. Herold just made, a lot of this information is inside this book, all the information inside this book. And we want to, listen, this is important. They have a 30-day Dare Champion. I am committing myself to the 30-day challenge, and I'm going to be the Dare Challenge for my family. And I want each one of you to think about being a Dare Champion. And I want you to know what that is. It's going to panel, please. Yes, please. We're going to let the panel come and have a seat, grab a water bottle. So before we leave today, I want every one of us to get in our minds one positive thing that you can change today. Okay? Is it cutting fried food, meeting with your friends more physical activity during the week, more veggies in your diet, stretching once an hour while at work? Whatever the thing is, write it down on your card. You can do this. And you're not going to do it alone. You're going to have a village walking with you. Mine is, and I've been trying this for a couple months, but now I got some accountability partners, is cutting out fried food. I noticed that when I started cutting out fried food in November, my cholesterol went down. It was simple as that. I had less heart palpitations from just simply cutting out fried food. And so please, there's a QR code on this screen. Everybody, you can take your phones out right now. Please scan this QR code and join the challenge. Don't just walk away and you heard a good word, you heard a good sermon, and you walk out the door and you get in your car and you go home and you're like the man in the mirror, you forget the image that you have seen. Do something about it. We've heard young people, we've heard an expert panel of doctors and therapists and psychologists begging us and letting us know that you can do this. I've read this book, and I'm going to tell you something. The information in here is powerful. Simple steps. It's readable on all different types of levels. Please Before you leave, go to that table and read this book. You are going to be making history, because I declare and decree, and I already told Dr. Joyce this, they are going to be international. This is a movement, and you are getting in on the ground floor of something life-changing. This is a game changer. Please take this to your homes, your families, your churches, your community, wherever you go, and you have people there around you sitting next to you. Pull this book out. Tell them that you were here today. Scan that QR code. Be a part of the family. Be a part of this. Come on. We know that you can do it. And so, without further ado, we want the host church, the host pastor, Reverend Dr. Marlon Tillman, to give us some last words. Let's give him a hand.
All right, so first off, we got to get a shout out to our MC, Felicia. Again, I want to give a shout out to the pastors under my charge, Pastor Hamilton. Pastor Hamilton's here now. Give him a shout out. Pastor Randall, Pastor Sutton, for being co-host. So this was recorded live on Facebook and YouTube. You can get it on the AIM channel for both of those stations. So as a good benediction, share it with folks who were not here. Amen. That's your charge, is share it with those who were here so that they can be blessed the same way that you were blessed. Too often when we hear a good word, we don't share it with nobody. I love the way Felicia said that. You hear a good sermon, and when the folks get home and say, well, what was the marriage message about? It was good though. It was good though. Share the video. Share the video with others so they can also be blessed. And because I am not ashamed of the gospel, we are having a revival on February the 7th. Yeah, I'm doing it. February the 7th, Friday service at 7 o'clock. It is called a 7-Up service. 777. And each preacher is told to preach for 7 minutes. Good luck with that. 7-Up worship service. It is, and you might recognize some of these names. Reverend Dr. Barron Young, Reverend Dr. Nate Johnson, and Bishop Roger Tatum are on the list of preachers. So you want to be in the house. On what day? February the 7th. What time? 7 o'clock. How many preachers? 7. It's going to be a 7-Up service.
All right.
All right. So please come on out and join us. And as in all churches, can I give a benediction? Of course. All right. Let me rise to your feet. Oh, and please don't make me have to take all these refreshments home. And the good part about it is all healthy. Yeah. So I noticed y'all was passing up the vegetables. Y'all was eating the fruit and the crackers. I need y'all to eat the vegetables too. Let us pray. Lord God, I thank you for this gathered community that came today to be healthy. Generational health, the dare to be healthy is an awesome responsibility for each and every last one of us. We heard the stats. Let's turn them around. And more importantly, may we share it with someone else, that we might draw closer to you. And I love what the brother said, live for somebody in your life. By you living well, you bless others. In the most precious and holy name of Jesus Christ, I pray. Amen. Amen.